What should the nurse do if a patient begins to fall while ambulating? Options are A. Hold the patient upright and continue walking. B. Try to catch the patient to prevent the fall. C. Lower the patient gently to the floor. D. Call for help immediately. The answer is C. Lower the patient gently to the floor. So, to prevent the injury, the nurse should gently lower the patient to the floor, supporting their body as they descend. Additionally, what you have to remember is do not try to prevent the fall. If you do so, you could hurt yourself or the patient. So, if a patient begins to fall, it is clear in the picture, you will step back and ease him to the floor. So, this will allow you to control the fall. So, after the fall, do not allow the person to get up until checked by you or checked by the nurse. What is the purpose of the Trendelenburg position? Options are A. Promote lung expansion. B. Improve venous return. C. Reduce intracranial pressure. D. Facilitate bowel elimination. The answer is B. Improve venous return. The Trendelenburg position, where the body is tilted so that the head is lower than the feet, is used to improve venous return in cases of hypovolemic shock. Which of the following is considered a sentinel event in healthcare? Options are A. Patient complains about delayed care. B. Patient develops a minor skin rash. C. Patient falls and sustains a serious injury. D. Patient refuses treatment. The answer is C. Patient falls and sustains a serious injury. Sentinel events are unexpected incidents that result in serious injury or death, such as fall causing significant harm. What is the priority nursing intervention when assisting a patient with ambulation? Options are A. Encourage the patient to walk quickly. B. Use a gait belt around the patient's waist. C. Stand behind the patient for support. D. Allow the patient to ambulate independently. Answer is B. Use a gait belt around the patient's waist. A gait belt provides support and ensure the nurse can assist in case of a fall or imbalance. How should the nurse position the patient for a lumbar puncture? Options are A. Supine with the head elevated. B. Prone with arms extended. C. Side lying with knees drawn to the chest. D. Sitting upright with arms resting on the bedside table. The answer is C. Side lying with knees drawn to the chest. The side lying position with the knees flexed and head bent helps open the spaces between the vertebrae, allowing easier access to the spinal column. How should a nurse position a patient after a liver biopsy? Options are A. Supine with legs elevated. B. Right side lying position. C. Left side lying position. D. High Fowler's position. The answer is B. Right side lying position. Positioning the patient on their right side applies pressure to the biopsy site, reducing the risk for bleeding. What is an example of a breach of patient's confidentiality? Options are A. Discussing patient information with a colleague involved in their care. B. Leaving a patient's chart open and unattended. C. Reporting patient's abuse to authorities. D. Documenting care in the electronic health record. The answer is B. Leaving a patient's chart open and unattended. Leaving a chart open and unattended allows unauthorized individuals to access private information, violating patient's confidentiality. When administering a cleansing enema, what is the appropriate height for the enema bag above the patient? Options are A. 6 to 8 inches. B. 12 to 18 inches. C. 20 to 24 inches. D. 30 to 36 inches. The answer is 12 to 18 inches. Raising the enema bag 12 to 18 inches above the patient ensure adequate flow of the solution without causing excessive pressure or discomfort. Which of the following is an example of beneficence in nursing practice? Options are A. Reporting a medication error. B. Performing CPR on an unresponsive patient. C. Following hospital policies strictly. D. Allowing a patient to refuse treatment. The answer is performing CPR on an unresponsive patient. Beneficence involves action that promote the well-being of others, such as performing life-saving measures like CPR. To make it simple, beneficence, the ethical principle in nursing, means taking actions that benefit the patient. For example, providing care, relieving pain, or even preventing harm. A nurse administers a medication without the patient's consent. What ethical principle has been violated? Options are A. Beneficence, B. Autonomy, C. Justice, D. Fidelity. Answer is B. Autonomy. Administering medication without consent violates the patient's autonomy as they were not given the right to make an informed choice. To be precise, autonomy is respecting a patient's right to make their own decision about their care. What is the first step in preparing a sterile field? Options are A. Open the first flap of the sterile package away from you. B. Put on sterile gloves. C. Arrange all equipment on the sterile field. D. Clean the surface where the sterile field will be set up. Answer is D. Clean the surface where the sterile field will be set up. So cleaning the surface ensures that the sterile field is set up on a clean and safe area, reducing the risk of contamination, which is the first step in preparing a sterile field. What is the correct position for administering an enema? Options are A. Supine position, B. Prone position, C. Sims position, D. Fowler's position. Answer is C. Sims position. The Sims position, where the patient lies on their left side with the right knee flexed, is the recommended position for enemas as it allows easy access to the rectum. What is the correct procedure when removing a patient's indwelling urinary catheter? Options are A. Deflate the balloon before removal, B. Pull the catheter out quickly, C. Irrigate the catheter before removal, D. Remove it while the patient is standing. The answer is A. Deflate the balloon before removal. Deflating the balloon ensures the catheter can be removed easily without causing trauma or pain to the patient. What is the first step when performing suctioning on a tracheostomy patient? Options are A. Insert the suction catheter before turning on suction. B. Administer oxygen to the patient. C. Apply suction during insertion of the catheter. D. Place the patient in a prone position. The answer is B. Administer oxygen to the patient. Hyperoxygenating the patient before suctioning prevents hypoxia during the procedure. What is the recommended depth of chest compressions during CPR for an adult? Options are A. 1 to 2 centimeter, B. 2 to 4 centimeter, C. 4 to 5 centimeters, D. 5 to 6 centimeter. The answer is D. 5 to 6 centimeter. During an adult CPR, chest compression should be, that is the recommended depth of chest compression during CPR for an adult is 2 to 2.4 inches, that is 5 to 6 centimeter. So this range will ensure effective circulation while minimizing the risk of injury. But it should not exceed 2.4 inch or 6 centimeter. When inserting an NG tube, what should the nurse instruct the patient to do to facilitate the process? Options are A. Hold their breath, B. Swallow water, C. Tilt their head backward, D. Cough during insertion. Answer is B. Swallow water. Swallowing helps the NG tube pass through the oropharynx and esophagus, making the procedure smoother. What is the proper way to cleanse the site before inserting an IV catheter? Options are A. Circular motion from the inside out, B. Wiping back and forth across the site, C. Circular motion from the outside in, D. Straight downward strokes. The answer is A. Circular motion from the inside out. Cleaning from the center outward prevents bringing contaminants from the surrounding area into the insertion site. After inserting a Foley's catheter, what is the next step? Options are A. Inflate the balloon with sterile water, B. Connect the catheter to the drainage bag, C. Secure the catheter to the patient's leg, D. Dispose of the catheter packaging. The answer is A. Inflate the balloon with sterile water. Inflating the balloon ensures that the catheter stays in place. This is done before connecting the drainage bag or securing the catheter. What is the appropriate size needle for an intramuscular injection in an average adult? Options are A. 18 to 20 gauge or 1.5 to 2 inches, B. 20 to 22 gauge, C. 22 to 24 gauge, D. 24 to 26 gauge. Answer is B. 20 to 22 gauge or 1 to 1.5 inches. For IM injections, a needle size of 20 to 22 gauge or 1 to 1.5 inches is typically used for proper medication delivery into the muscles. When performing wound care, what is the correct order of cleaning? Options are A. From the outer edges to the center of the wound. B. From the least contaminated area to the most contaminated area. C. From the most contaminated area to the least contaminated area. D. In a circular motion regardless of contamination. Answer is B. From the least contaminated area to the most contaminated area. Cleaning from the least to most contaminated prevents the spread of bacteria and thereby reduce the risk of infection. How should a nurse position a patient for insertion of a urinary catheter? Options are A. High Fowler's position. B. Supine with legs extended. C. Lithotomy position. D. Semi Fowler's position. The answer is C. Lithotomy position. The lithotomy position allows optimal access to the urinary meatus, making catheter insertion easier, especially for female patients. How should a nurse check for correct placement of an endotracheal tube after intubation? Options are A. Check for misting in the tube. B. Listen for bilateral breath sounds. C. Confirm patient oxygen saturation. D. Assess for equal chest expansion. The answer is B. Listen for bilateral breath sounds. Bilateral breath sounds confirm proper placement of the endotracheal tube in the tracheae rather than one of the main bronchi. This will ensure effective ventilation. When performing urinary catheterization, how should the nurse cleanse the perineal area in a female patient? Options are A. Wipe from the pubic area to the anus. B. Wipe in a circular motion around the meatus. C. Clean from the anus to the pubic area. D. Wipe horizontally across the perineum. Answer is wipe from the pubic area to the anus. Cleaning from the pubic area to the anus prevents contamination of the urinary tract by bacteria from the anal region. What is the correct action for administering a blood transfusion? Options are A. Start the transfusion at 100 ml per hour for the first 30 minutes. B. Monitor the patient's vital signs every 15 minutes throughout the transfusion. C. Use a 20 gauge or larger needle for the IV line. D. Discard blood if it has been out of the refrigeration for more than 8 hours. Answer is C. Use a 20 gauge or larger needle for the IV line. Using this is required to prevent hemolysis of red blood cells and allow smooth transfusion of blood products. During oral medication administration, what should the nurse do first? Options are A. Verify the patient's identity. B. Explain the purpose of the medication. C. Administer the medication with water. D. Check the patient's vital signs. The answer is first, verify the patient's identity. Patient identification is a priority to ensure the medication is given to the correct person, avoiding medication errors. Which of the following interventions should a nurse prioritize when preparing to administer oxygen therapy? Options are A. Turn on the oxygen and leave the room. B. Place the oxygen mask before turning on the oxygen. C. Check the oxygen delivery device and tubing for patency. D. Set the flow rate to the maximum to ensure effectiveness. The answer is C. Check the oxygen delivery device and tubings for patency. Ensuring the device and tubing are functioning properly, which is very essential for effective oxygen delivery as well as for patient safety. What is the recommended flow rate for administering oxygen via a nasal cannula? Options are A. 1 to 6 liters per minute. B. 8 to 12 liters per minute. C. 12 to 15 liters per minute. D. 15 to 20 liters per minute. The answer is A. 1 to 6 liters per minute. A nasal cannula is designed to deliver oxygen at low flow rate between 1 to 6 liters per minute, providing 24 to 44% of oxygen concentration. Hey nurses, if you find the video useful, please like, share, subscribe the channel Nursing Exam Insights, your ultimate resource for all nursing exams. Thanks.